My name is Kathy Schmidt. I am a registered nurse who's now retired after 37 years of service at Kaiser Permanente at Sunnyside in the critical care arena. I was part of our organizing committee in the late 70s. It was just the start of organizing unions and negotiating contracts in the healthcare industry because the Labor Relations Act was amended in 1974. And so we ended up searching, and it was just really by a fluke of a press release that one of our earliest activists found in the Oregonian about the announcement of the establishment of the Federation of Nurses and Health Professionals within the AFT, the American Federation of Teachers. And after interviewing some of the organizers in the AFT, we decided to attempt to form a union. Our first president, Patty Adams, was our catalyst to say collective bargaining might be a good option for us. I'm taking a class and I heard about this thing called collective bargaining. One of the early realizations that we had is that despite all of our differences, political differences, social value interests, economic backgrounds, educational backgrounds, we did not have the luxury of disunity. I mean, it was a pretty new concept to us to have to prepare to walk off the job to get a first contract.
Meg, did you want to add anything?
In helping to make the decisions right down to where the rubber meets the road, and that's where the patient care is done. It can't help but better that system when the worker has the ability to make a difference, a decision, it's heard and it's implemented. And that's what I'm very excited about.
My name's Jamie Lorenzo. I work as a charge nurse in Spa PACU at Kaiser Sunnyside Hospital. Being led into the nurse staffing committee for the hospital, and I became the co-chair for that and kind of getting involved on a broad level of the issues throughout Kaiser. Kaiser changed, the institution changed, and it forced us to organize and do what was right for our patient. So I felt like I got to see the union grow and organize. As I was figuring out what the union can do, it was figuring out how we can do it together. So I came to the Northwest from Phoenix, Arizona, which is a very non-union friendly state in general. The hospitals there actually run out unions as quickly as possible. It makes me appreciate, what we have here and what the union has done and my predecessors have worked to accomplish and achieve for us.
My name is Adrienne Inghouse. I've been a registered nurse for 22 years, and I am the president of the Oregon Federation of Nurses and Health Professionals. So it's a super exciting time for us to be able to really grow the leaders of this organization. 2 years ago, the board, we fleshed out more of a plan, and the leadership development committees worked really hard. There's unions 3 times bigger than us that don't bring as many people as we do. So we bring 40 people to a conference, 30 people to a conference. Everyone's going to have as much information as we can give because then they're empowered. What's really exciting about that is we're starting to be able to have our members' voices elevated to a place where policymakers and legislators are going to hear their story. They're going to hear why staffing laws are important. They're going to hear why workplace violence laws are important. They're going to understand why all the people in our community need health care. And we can tell that story better than anyone. Our member's voice is going to be so much more powerful because it comes with a story. It comes with a story of a baby that was born early in the family that can't bond with it because they don't have medical leave. It comes with a story of how a traumatic injury on the work site ruined someone's career and now they're bankrupt. You know, we tell the story on behalf of our patients in a way that legislators hear and can act upon.